Hello, SIBO Doctor community. It's Dr. Norala Jacobi, the SIBO Doctor, and doing a Facebook Live today about mold toxicity and the hidden menace. It's really appropriate because in this area, where our clinic is and where SIBO test is, we've actually just had massive flash flooding due to very, very heavy rain. And the road's actually cut off. So I'm all by myself here in the clinic. So if anything goes pear-shaped, that's because I have no staff here. But that's all right. We can manage. But so yes, I thought it was really appropriate actually, because oftentimes when there's really severe weather events, we are at risk for mold toxicity. And I'll explain that as we go on. But first, let me just introduce a little bit the SIBO Doctor to people that are joining us and have never attended or watched one of my Facebook Lives. I do these twice a month, once for live Q&As if you have questions about SIBO, and once is more of an educational presentation type, 30-minute, 45-minute, talking about what underlying causes exist for SIBO, for example, or different themes and different topics that relate to SIBO. My area of expertise, as my name implies, or the SIBO Doctor implies, is that I'm a SIBO expert. I've been in this field for almost 10 years. I've been a naturopathic doctor for well over 2 decades and have really focused my area of specialty in functional digestive disorders, including SIBO, and have created a website that's an educational website for both practitioners and for patients wanting to learn more about SIBO and overcome this really complex condition. And the website is called thesibodoctor.com, where you can find free resources like the biphasic diet I created and different training courses for practitioners. We just released the SIBO Mastery course for practitioners, and those that have completed will be listed in our SIBO treating practitioner database. And patients can also find the SIBO Success Plan there, as well as other free resources. So really, that's been one of my passions. And the reason why mold really came up for me is because when you specialize in a really niche condition like SIBO, you really do see people that have failed treatment, have gone to many, many different practitioners, and end up in your office. And very often there are a number of underlying causes or causes that you have to really investigate. And mold is something that's been in my consciousness for quite some time. And recently I've had the great pleasure to talk to Dr. Jill Christa on my podcast, and I'll share that in a moment. But also her resources are really useful for those of you who resonate with what I'm going to share with you today. Hello to everyone who's joining from all over the world. It's really nice to see you, some of the people that often join us in these Facebook Lives, and it's nice to see people have interest in this topic. Now, also, the other thing I want to say is, so every other Thursday is either a Facebook Live on a topic like this, or it's a live Q&A. I'm looking very disheveled and wet because we have a severe weather event here in the Northern Rivers with severe flooding, and the road to this area is flooded. So mold is growing as we speak, probably. Now, let's get started. So one of the things I want to show you, let me just actually, it's worked. Yay, technology. So this is a graph I created that often comes up in both the SIBO Success Plan and the practitioner, the SIBO Mastery program, because I'm really interested in finding the underlying cause of SIBO for a patient. Remember that SIBO itself is actually not the primary diagnosis. SIBO is caused by something. So that's always really important to keep in mind, is that if you're on this merry-go-round of doing antimicrobial after antimicrobial and you still don't know why SIBO exists in your case, then I encourage you to work with a practitioner who will work with you to find this cause. And it's not, to be honest, it's not always that easy, because it can be very multi-layered, but it's still really fruitful to look into the underlying causes. There is a questionnaire that you can download for free from the SIBODoctor.com website called What Caused My SIBO? And it's a questionnaire that you can download and complete and take to your practitioner. Now, I'm hoping, let me see if I can actually do, if this works. Yes, wonderful. Okay. So what you see here are the 4 primary categories of underlying causes. And I have a whole separate Facebook Live that I recorded on this graph, and I go through all the different categories. So I encourage you to review that, because we're not going to go into all of the different areas. Suffice it to say that we have the primary category of the issue that caused SIBO is a problem with the motility of the small intestine. And that can be due to the injury to the migrating motor complex, which is basically the cleansing wave that occurs every 90 minutes on an empty stomach in the small intestine. And when that's impaired, you are much more likely to have SIBO because bacteria are allowed to remain in the small intestine. So that's what Dr. Pimentel, who's a premier researcher about SIBO, his primary cause for SIBO is. I find that there are usually a number of causes that create a chronic kind of relapsing case for SIBO. So that's certainly one primary one. Then we also have some sort of traumatic brain injury possible. Hypothyroidism can be in this category as well. That definitely affects motility. So the concept is that if you have slowed motility in the upper gut, in the small intestine, you can't clear bacteria out. And interestingly enough, you can have an impaired motility in the upper gut, but still suffer from diarrhea. The frequency of bowel movements is not indicative of whether or not you have a motility issue in the upper gut. Just wanted to clarify that. Also, chronic infection like Lyme disease or chronic viral infections and things like that can be problematic for causing motility issues. And diabetes as well, we know that for sure. And here we go, mold toxicity. And this is the reason I've sort of almost dedicated this whole week or 2 weeks to this mold issue. We just released Dr. Jill Krista's podcast that I did with her. I'm doing this Facebook Live on it, and I think it's just such an important issue that's so often overlooked. And practitioners often feel really overwhelmed with this whole idea, how do you tackle mold? So the issue really is, let's see if I can do this again. Let's go to this kind of view. Let's have me be a little bit, get disoriented otherwise. So the whole point about mold is that people often think mold only grows if your basement got flooded or your house got flooded or you've had really visible water damage to your building. Well, that's not actually true. If you listen to the podcast that I did with Dr. Krista, let me see if I can bring this up. Yes. So this is the podcast we just released. This is found on the SIBODoctor.com, or you can go to iTunes or wherever you listen to your podcast and listen to this really fascinating conversation I had with this mold expert and the connection between SIBO and mold. So really what we're talking about is, and I'll bring that up again in a moment. So, but the issue is that, let's say that you have clearly water damaged building, like many people will experience in these severe weather conditions that we're experiencing on the east coast of Australia right now. We are blessed to have the rain. I'm not ungrateful for the rain, but we are experiencing extreme weather conditions. So world, please stop praying for rain for Australia. At this point, we are all set with rain and all the fires have been truly extinguished. So what's going to happen is when houses flood, mold can easily grow in drywall, in the foundation, in all the building materials of the house. And what happens is people often just do remedial work that's incomplete, and mold can then continue to grow even though you're not seeing it. So that's one often a common cause, but you can also have mold exposure where you don't see any mold at all, where you might have a small leak from the heating, venting, air conditioning units. You can have mold growing out of sight. You can't smell it sometimes. Of course, if you're in a musty basement, you know there's mold there, but oftentimes when you're in your house and you've had a small leak somewhere, you don't necessarily smell it. And the problem here is that mold secretes toxins called mycotoxins. And mycotoxins are odorless, and you can't smell it just walking into a building. And it can cause, mycotoxins are extremely toxic substances that are virtually every organ system that we know. So your kidneys, your liver, your digestive tract, and this is the reason we talk about it here, is because of the link between mold exposure and toxicity and SIBO. So what happens is when you have extended exposure to this type of toxic environment, those mycotoxins end up being very toxic to what's called the myenteric plexus, which is really the nervous system of your digestive tract. And so therefore really affects motility and allows bacteria to remain in the digestive tract. There are a couple of other reasons why SIBO is connected to mold, but it is a really common side effect of chronic mold toxicity. And I've had cases, now that I've really immersed myself much, much more into this topic, I often consider it when people have the following symptoms. So they often have sinus issues or hay fever. They've often had sinus surgery, or they've had they just have chronic nasal issues. Sometimes they don't, but they have histamine intolerance. Histamine intolerance is very common. They have chronic yeast problems that they can't get rid of, really tenacious types of yeast, or SIFO and fungal issues. And they have a lot of systemic issues like chronic fatigue, myalgias or aching. There's also weird symptoms like sun sensitivities and lots of different symptoms that you wouldn't at all connect to SIBO or anything specific. So this is why people often go from practitioner to practitioner treating SIBO, which does exist, but really what's driving this is this underlying toxicity of mold. One way that you can find out if you actually might have some mold exposure is go to Dr. Krista's website. I think it's drkrista.com. And, there is a questionnaire that you can download and score yourself and see if this is a potential issue. If you're in an area that gets a lot of rain, like Seattle, I used to live in Seattle. Now I live in the Northern Rivers, which gets the same amount of rainfall as Seattle. There is a lot more at risk, but really mold grows in a humidity of about 50%. So you can have mold issues fairly easily, really. But also hidden ones like CPAP machines, the tubing in CPAP machine. Anywhere there's moisture, you can have mold issues. So so she also has written a book called Break the Mold, which is a good resource for patients to understand how to even tackle it. But really, what needs to happen is if you test high on this questionnaire, then I encourage you to find somebody that can work with you as a mold specialist, or at least has some knowledge about mold and how to treat it. Not just remediation in your house, but also how to protect your organs from mold toxicity or mycotoxins, and how to get out of this situation, because it's not easy. I tell you that. I've had a lot of patients that are so sensitive. They have salicylate sensitivities, histamine intolerance. They can't tolerate sulfur. They're just so sensitive that even products or supplements that we give them can be really too much for them. And that's also a classic symptom. I would question whether or not you have some issues with mycotoxicity if you react all the time to supplements and to medicines and things like that if you're very, very sensitive. I'm not suggesting that everyone who's sensitive has mold, but it's just such a pervasive problem in many of our dwellings and in our environment and things like that, that I think it's really, really important for practitioners to also understand it, because a good portion of people that are referred to me, I have found, have some element of mold toxicity. There is a test where you can check for mycotoxins. That's done by Great Plains Lab in America. And if you're in Australia, practitioners can also order that. And it can determine whether or not you have a high level of mold toxicity or mycotoxicity in your system that's affecting not just your detoxification system, but also your digestive tract. So really, people that have chronic SIBO, they're clearing SIBO and yet their symptoms aren't improving. And if you score high on the questionnaire, then definitely consider that. All right. I think, we just actually, yes, somebody just posted the link to the mold course that Dr. Krista has created for for practitioners. This is a very specific course for practitioners, and for patients, there is the book. So it's a really great resource, and I encourage you to go there. Okay, I'm not going to answer questions specifically about SIBO. I'm sorry, Juan. This is more of a mold-specific educational piece. So hold your questions until 2 weeks. I think we have the live Q&A. So this is more less of a Q&A, more of an educational piece. All right. So what are the tests for mold? Good question. So the best way to find out if your house is toxic is to get a mold inspector, or go by different names, biological building inspectors, and find somebody that doesn't also offer mold remediation, ideally, because that's obviously a conflict of interest. They're going to probably find mold because they're going to want to fix it. So if you can get an inspector to inspect your house, what they do is they should spend a good 2 to 3 hours in your house, going into crawl spaces, taking air samples. And Dr. Krista also has some handouts, I think, on her website on questions to ask. But certainly if you get the book, Break the Mold, she has more tips there for you. So it's about finding out whether or not you have this, and then using a proper mold remediator. And the most important thing is also, obviously you're going to have to get more information on that and perhaps get her book and stuff. But sometimes when you move from a mold toxic house to a non-mold toxic house and you move all your furniture, you're kind of taking the problem with you. So this is why it's so huge when somebody is mold toxic. Oh, the other really important thing I need to talk about is that you also, when you're exposed to mold and mycotoxins, I should say, what happens is all of us in our nasal mucosa have some mold. It's normal to have a tiny bit of mold or yeast. It's just a mucosal microbiome. But the sinuses, and this is why I mentioned sinus surgery and sinus symptoms in the past, are frequently associated with mold issues, is that when you've had a lot of mold exposure from a toxic environment, your own microbiome in your nasal cavity can actually turn toxic and then upregulate its production of mycotoxic substances that then is like a little mycotoxic factory. So what we do is, other than the mycotoxin panel, we also get swabs of the nasal cavity to see if they're fungal and bacterial elements that are secreting both mycotoxins and endotoxins. So that's kind of like a quick and dirty about testing. And then what happens is you really need to enter a program that focuses on strengthening your organs first, and then we tackle the mold that might be inside of you. So it's a bit lengthy, but I wanted to let you know about this problem because it's pervasive. if you're listening and you have a lot of sensitivities, you've been treated for SIBO, and you haven't really found the underlying cause yet, remember this graph, you've kind of gone through every category and you're looking to find the cause of your SIBO and it's still very evasive, then consider mold if you tick a lot of the boxes on the mold questionnaire that you can find on Dr. Krista's website. And if you need more information about mold, hang on if I can do this. This, again, is the podcast I did with her very recently. We just released it a couple of weeks ago, I think. And we just this whole month, we're also featuring different quotes from her and stuff like that, because I think it's just so important for chronic SIBO to have it at least be considered. So again, you can find the link to her mold course for practitioners in the comments below, or you can go to the SIBOdoctor.com and listen to the podcast. And in the show notes, there is all the information there. Let's see if I have any other. Somebody asks about Candida. Candida is often. I often tell my patients, look, Candida is just an opportunist, right? So it's a normal part of our microbiome. But when things happen, like you've wiped out all of the natural, organisms that keep Candida in check, like Bifidobacterium and Lactobacillus, when they're gone because you've taken tons of antibiotics for different conditions, then Candida is a really likely consequence of that. And Candida can overgrow. And Candida can cause leaky gut because it creates little feet called hyphae that squeeze through between the enterocytes or the cells lining your intestinal wall. And it can cause a lot of problems. In and of itself, it can cause issues like brain fog and bloating and can be very similar to SIBO. And that's the other issue, is that if you're not getting any better and you haven't really had any treatment for Candida, that's another area that you might want to consider. And typically the test I recommend for that is much more of is an organic acid test. So it's not a breath test. You can't detect the Candida on a breath test. You have to do something called an organic acid test. A stool test is quite unreliable for that. And people with Candida overgrowth often are even more sensitive to moldy environments and mold toxicity. What are your thoughts on the Shoemaker protocol and testing for MARCoNS, MSH, AHD, all that? Yes, great question, Amir. So Dr. Shoemaker, Dr. Richie Shoemaker, is a US physician who first sort of brought mold toxicity into the limelight, I think about a decade ago now or so, and he has training courses for practitioners. And it is it's a really conventional protocol, and I'm not dissing it at all. I'm not a Shoemaker licensed kind of mold expert at all, but it is still, it's very involved, and he tests for the different markers that can go awry when you have mold exposure, and then uses things like cholestyramine as a binder and different medicines to try to overcome this mold issue. What I love about the other mold course that I've just taken from Dr. Krista is that it's extremely naturopathic, and it's focusing on organ support before you go in there to kill mold. So that's, from that perspective, I really appreciate that. That being said, the markers that you mentioned, we still kind of check for them. Not all of them, but some of them, like MARCoNS or methicillin resistant coagulase Staph aureus is an organism that is resistant to a lot of bacteria and often found in sinuses. And we do swab for that, for sure. And the other markers, I find that if I have somebody that has a mycotoxic exposure and it tests positive on a urine test, I don't necessarily need to do these tests. Chronic mold exposure will also give you weird lab results like randomly your liver enzymes can be elevated, or you have kidney problems, or your white blood cell count will be affected. And so lots of different random odd results on a test result. And but back to the Shoemaker protocol, the one thing I do recommend for people to do is the visual sensitivity test, which is on his website, survivingmold.com. And it's a really cheap peripheral visual test, because when you're mold exposed and toxic, you have issues with peripheral vision. So you can do this online, this test, if you just go to survivingmold.com. That's another kind of quick one. If you test really high on the questionnaire, that is on Dr. Krista's site, or in the book. I think it's also might be in the book, I'm hoping, Break the Mold. So yes, so this is the other thing. But I think naturopathically there's a lot we can do. And I just think it gives us a huge area of tools in our tool belt, in those of us, or if you're a practitioner listening and you're specializing in SIBO, I think it's really something you have to wrap your head around and get very good at, because you will see it. You will see people with chronic SIBO that really have an underlying mold toxicity. Okay, Heather asks, thoughts on Candida assumption with the spit test. You know, I just don't think that's a foolproof test at all. And the idea is there a certain stringiness of the saliva when it's in the water. I don't use that, so I can't comment on that. I don't, you know, maybe I just require more hard data. Does mold affect potassium absorption in the body? Good question. I don't know. I wish actually Dr. Krista was on this Facebook Live with me, but I don't know. I don't know the answer to that. That's I don't see how. Well, one thing that does happen, and it affects more global absorption of issues. It certainly can have a low iron component. That goes without saying. But it blunts. If you look at the cells that line your small intestine, they look kind of like Bart Simpson, for lack of a better descriptive term. But it's a cell that has hair-like structures on its surface. And what happens with mold exposure, besides it being toxic to the nervous system of the gut and therefore causing motility issues, it also affects the hairs on, well, no, they're not hairs, they're microvilli, but these are affected and they can be blunted. So there can be a problem with brush border enzymes, because that's where they are. That's also where diamine oxidase sits. So your issues around histamine intolerance. So absorption can definitely be affected. So, but not specifically just one nutrient. Okay, Omar asks how to confirm that my SIBO is caused by a motility disorder. Great question. So if we go back to, let me hide this and go back to this graph. So here are all of the areas that can be affected by or can cause SIBO through a problem of motility. So the first one, the autoimmune or MMC, is where the food poisoning that you might have had previously caused an autoimmune response and damaged the migrating motor complex, which is one of the most important aspects of upper gut motility. You can do a blood test called the IBS SMART if you're in America. If you're in Australia, I have excellent news. It's coming extremely soon. Stay tuned. So we are able to test for that now. And if you have high antibodies to vinculin and CDTB, then you have an autoimmune type of SIBO for which you need proper prokinetics. So those are the people that really require a well-working prokinetic. Traumatic brain injury is, you might want to listen to, so we're just talking about how to find out if SIBO is caused by dysmotility. So if you've had like a brain injury before, or like a traumatic brain injury, if you've had a concussion, if you've played sports or things like that, then your dysmotility might be due to traumatic brain injury. And that's always the toughest of them all to figure out. But if you listen to my podcast with Dr. It's not a doctor, but she's a neurofeedback therapist, Kayla Sandberg Lewis, she explains this whole issue about traumatic brain injury. Hypothyroidism, that's easy to check. So if you have hypothyroid, it's likely that SIBO has something to do with it. And chronic infections, if you have Lyme disease, if you have Epstein-Barr reactivation, if you have chronic fatigue from chronic infections, it also affects the nervous system. So it's also possible. So find somebody that can test you for that. Diabetes, we understand why that causes dysmotility, because unchecked blood sugar can attach itself to nerves, and any kind of what we call glycated proteins and nerves can be affected. So that can also cause dysmotility and gastroparesis or slow gastric emptying, etc. Mold toxicity is basically what we talked about here. And dysautonomia is a dysregulation of your autonomic nervous system. That's the nervous system that regulates all the things that you don't do consciously, like breathing. Well, most of the time your breathing is unconscious, heart rate and heartbeat, and all these other functions that you're thankfully unaware of. And so Epstein or Ehlers-Danlos syndrome, or EDS, POTS, or postural orthostatic tachycardia syndrome, and mast cell activation syndrome are all part of this group of dysautonomia that can also affect motility. So find a practitioner to help you determine whether or not this is a problem. And then an autoimmune disease called scleroderma. Okay, now, okay, good question. Can only some members of a family be affected by mold, but not others in a mold-affected home? Excellent question. So the answer is everyone has will be affected. Whether or not you have symptoms, that's another issue, because some people, for example, have let me give you a scenario. Let's say that you have a family of 4 and 2 children that have had a lot of ear infections as children, had a lot of antibiotics and antibiotic after antibiotic, and developed really a microbiome that's not very healthy, that's now contributing. It's like they're constantly absorbing endotoxins from bacteria and internal fungus, and they live in a mold toxic house. Those scenarios, in that scenario, that those children probably would be affected sooner, because they now have an internal source and an external source. And so it really depends on what's going on for each person as to how quickly they develop symptoms. So, but great question. I'm not going to ask general or answer general questions about SIBO, because I want to keep this very specific, and I'm going to finish it up in just a couple of minutes. So if you have really specific questions about mold, again, some of the resources are listed below. I encourage you to listen to the mold toxicity podcast that I did with Dr. Jill Christa. There's 2 parts to it, and there's a lot of information where you can get more answers. Also in the show notes, when you go to the SIBOdoctor.com, you can find her website, the link to the mold course. If you're a practitioner, you get 10% off for being a SIBO Doctor listener. So yes, so a lot of issues to consider when we are mold toxic. Let's see if there was anything else. Yeah, I think that was it in terms of testing for mold and the issue about mold. So I'm hoping this gives you enough to get your brain thinking about whether or not this could be a problem. Again, you can go to her website and find out by getting the questionnaire. One last question is, do you treat mold first, then SIBO, or both at the same time? So when somebody comes to me and they have classic symptoms of SIBO, I just test for that. If they test very high for other, or in the questionnaire, they have a known toxic mold exposure, or they have a lot of the classic symptoms, then I might go ahead and do a mycotoxin test as well. But really, most of the time, I see patients that have already been treated multiple times for SIBO. So I am somebody that does see a lot of problem cases, and mold definitely complicates matters. So again, if you're living on the east coast of Australia, we're having severe weather right now with flash flooding and lots of water coming every which way. Our backyard is turned into a giant lake, actually. So mold is in the air, so to speak. And so just be aware that this can be a big problem in extremely wet areas. So that's, I think, my final thoughts. And if you want more information, go to thesibodoctor.com and listen to the podcast. If you enjoy these fortnightly Facebook Lives, please leave us a review on the SIBO Doctor page. It's always so appreciated. And really, I do this from an educational, as an educational offering for you so that you can find your way and finally be SIBO free, or at least have some sort of sense of empowerment that you understand why you have SIBO and how to really overcome it for good. So with that being said, I am going to sign off, and join us in a couple of weeks for our, I think it'll be set our February Q&A. I have to just think for a second, but yes, so that's where I answer all of your general questions about SIBO that you may have. So until then, stay dry, and I'll see you in a couple of weeks. Take care.